Hello, everybody. Good morning, good afternoon, and good evening for everybody. I'm very glad to be speaking to you today about what has happened in Saudi Arabia and our experience in COVID-19 in terms of technology, utilization, data communication, and how we used our existing digital technology, looking forward to have better public health technology in the future. Next slide, please. Past were directed toward hospital case setting or public or primary healthcare setting. The public health digital services was not as we faced right now. So what we said to ourselves when we saw what's happening in countries with good or actually better in the best top 10 countries in the world with healthcare system, we saw how they were their healthcare workers were not capable to cope with the public health services and approach. Public health practitioners were struggling and get exhausted in the beginning of the disease. When we looked at ourselves, we said, okay, let's sit back, let's set up our team, let's look at our technology. We have many technologies on the ground. We need to look at it. We see what we can benefit from what we have on the ground. And let's kick off. We have our command and control center. We have the emergency operating center. They are there. They are functioning for a few years right now. Let's make them readier and let them ask for what they want in order to make our technology team ready to help us in this pandemic if it happens at all in Saudi Arabia. Then we looked at our dashboard room, actually, which is our National Health Command Center. And we that center actually has launched its function officially about a year ago, and it was getting in the preparation for the past 2 years. That command center actually looks into the hospital operations and primary healthcare operations. And we said to ourselves, can we utilize that? Can we transform that into something else? Yes, let's look at it and let's review how can we get benefit from that. So that is our dashboard. The third element on the slide is the education and awareness. We know, or we knew that time, that this is a new disease, a new virus hitting all countries. I'm still in the first class, in the first slide, previous slide. Hitting all countries, people getting information from everywhere. We have good information and bad information. So we thought of why don't we develop our communication system, making our information appropriate. So we created our portal of all scientific communication available, easily approaching people. Education, we made our education tailored for people. So we used our existing digital system to help us in that. The fourth element is how we add to enhance our digital application. We in Saudi Arabia, as I said, we have, we will show it, I will show you in a few minutes how we used our existing model and we added to it some new digital technology. And we also partner with the SDAIA to make sure that we have a very collaborative digital system that helps in pandemic control. The last part is the camera and security. From my background as an infectious disease prevention and control consultant, when we look at infection control practice, usually in such a disease, respiratory disease, most of the transmission happens in the crowded and high mobilization area, like the emergency room. So we thought that we need to make sure that we have a very good viewing on the emergency room by implementing and making cameras available in all mobility units inside the emergency room, preserving the patient's right and confidentiality, making sure that we can even with this camera, we can define the people who are in contact if in case a case has happened and trace them back, go back to them, catching them up, making sure that we test them and make them under our radar. So that is basically the presentation is about. I will focus on some of these areas to show how we in Saudi Arabia handled such a program of merging the old school public health with the new digital area or new digital era that we are looking forward to have in public health. Next slide, please. This is the room that we are watching our public health. Actually, all of our functions in the public health. This room, as I said earlier, it was built for hospital operations and primary healthcare operations and supplies. During this pandemic, we thought or we think, why don't we make this room readily available to help us in controlling the disease, looking at cases. We can even drill down. I will show you also in one of the slides how we can drill down to a single case to define it. In this room, we have all the dashboards that we can look at our available beds, available isolation rooms, available ICU beds, our ventilator, functionalities of the ventilators, functionality of the emergency room. We can see the cameras in the emergency room that I just talked about from this room. We can also look at contact tracing, easy testing. We can look at the mass testing, you name it. We have it all in this command center. So we converted this National Health Command Center to a command center where we can observe all what's happening on the real ground during this epidemic or during this pandemic. Who can access data from this room? The minister, the vice minister, all the deputy ministers, other healthcare sectors leadership, all the other governmental entities who might need to help us, so they can look at this room, look at the content of the materials in that room, and they can develop their system to help us moving forward in a better way. In this room also, we have, because it's a clusterized disease, as we heard earlier from Dr. Ali, when we have a cluster and the super spreader make a network of cases around him, we have an early warning system in this room where we can spot on the growing clustering area, so we can capture it, trace it, make sure that we get all the cases prior it spreads out of that cluster. So that room was kind of a great added value to us. Next slide, please. Our second pillar was the mobile health support. We in Saudi Arabia, we used to have the Maw'id system. Maw'id is an appointment, which is CAS, which is Central Appointment System, where people can reach out to this appointment system. But anybody who has an official residency in Saudi Arabia can just use their ID. They put their data, and they get an appointment in the primary care. We said we can use this central appointment system or Maw'id to screen people, to make it like a triaging point for people. So people, they triage themselves on Maw'id, and then those who have symptoms will be escalated automatically for an appointment. So what we were trying to do in here, we were looking forward to make sure that our symptomatic people are being looked at. Why? Because we want to make sure that at least 80% of symptomatic people get traced, tracked, and diagnosed. So we were trying to improve our symptomatic people approach or delivery of care to them. And we used this this was our first tool we used in the epidemic. Together with the 937 is our health call number. It's well known in Saudi Arabia. anybody call 937, they will have access to all kinds of services. These services, either general services or healthcare question, or even consulting a physician. So we made that available, and I will show you how our number grows up in a bit in the 937, which is again has another arm inside it. Instead of telephone call, we have an app which is called Saha. We also empowered our Saha app, where people can consult a physician either through texting through the Saha app, or through telephone conference through the Saha app, or through video consultation as well. We have also empowered our chatbot, where we created some digital. It's a new thing. We created some digital artificial intelligence in its preliminary phase, where people, they put some of their symptoms and it takes them to different portal of healthcare access. So this is how we use our existing mobile health support. Next, please. This how we used our again. This is these two apps are readily available in Saudi Arabia. They were in the, I don't want to say a beta version, but they were on their trial, and we were pushing for them to capture all health care services to people under Sahati, the one on the right hand side, and all practitioners, they can access their services through Anat, the one on the left hand side. Why we have these two, or why we chose these two? Because they were already existing, and we wanted to capture on them, making sure it deliver public health services as well. This is these two apps are going to be the future app in Saudi Arabia for a provider of care, which is Anat, and the recipient of care, which is Sahati. The Sahati gives everybody, today, it gives everybody the Maw'id, which I spoke about earlier. They can book their appointment through it. It provides them all the healthcare education and awareness. It provides personal health dashboard. It gives you your weight, your exercise, your blood pressure dashboard, your heart rate dashboard, what have you. So it is a very beautiful app. People can book appointment for tests as well. We have the mass testing. We also have on the other side, the Anat is the physician platform, or the practitioner platform. I can prescribe my medication to my patients in here. I can also give a prescription for somebody, a suspect case. I can give him a leave for 2 or 3 days until he get tested, until he get cured again. We can do all of that through Anat. If we look in the middle, we have Teams. We used also Microsoft Teams to conduct a virtual consultation. And the virtual consultation took a very big role in the Saudi healthcare system during the curfew, where people get stuck. They want to see their doctors. Many of them, they're afraid to go outside. So we gave them the opportunity to use Teams to consult their physician. Next, please. This is how our doctors and our patients see the, on the right-hand side, see the consultation platform on Teams or Sahati as well. As I told you, I will show you some numbers. In Saudi Arabia, in the first half of the year in 2019, we had, on the medical consultation app, we had 1.3 million. And this year, first half of the year, we have 4.3 million. Of course, the growth, bulk of growth because of COVID. On the 937, the phone call, we had in 2019, in the first half of the year, we had 4 million calls, medical calls. And in 2020, we have 13.2 million by the end of June this year. So it's a tremendous growth. people loved to use the technology. So is there an opportunity to have further growing or further development in public health? The answer is yes. We need the tool to be more available. Next, please. تقصي, which is contact tracing. Remember the slide that I show you, our National Health Command Center room? Unfortunately, the picture is very small. This black circle in the middle is the circle which we love. I'll tell you a story about this. As I said earlier, that many countries in the beginning where we saw them getting exhausted, their public health practitioners get exhausted because everything, public health platform were not ready. We said, let's go and develop something. تقصي means tracing. So we created this online platform for tracing our cases. So in the beginning, at the very beginning, before this was kicked off, we started on the conventional tracing technique that public health practitioners do, where people go using their small notepad or paper, write some information, and then go back home or to the office, put the data on Excel sheet, send it, and it is a manual kind of public health intervention. We said we cannot live with that, especially if the number grows up. We need to create something. So we focused, we created تقصي thanks to our team and the Ministry of Health. They created this تقصي. The black dot in the middle or the black circle in the middle, every dot inside it is a case. If you click on that case, it will show you a bigger picture. Each case indicates either or tells you if this is an index case or if this is a primary, secondary, or tertiary case. And it tells you the contact. It tells you contacts by definition, by ID number. So we can go back to patients or to contact list by ID number, by phone number. So it defines everybody. And we can see that inside that National Health Command Center. 8 information that we can get, or 8 elements inside this تقصي program. 4 of them, the 4 on top is people can use, all healthcare workers use تقصي to enter all the patient's data or the client data inside the mass testing program. So before you test everybody, you triage people, you put all the information inside it. The second box, which is active target surveillance. So we use it also in active targeted surveillance when our team goes into an area where we suspect an outbreak or something. As Dr. Ali mentioned earlier, when we have a case and multiple cases around it, we send our team, they do active targeted surveillance for that population. They use تقصي, so they enter the data in there, and it will all automatically reflect on that black circle. The third one is contact tracing. We do all of our contact tracing through تقصي. The last one is COVID-19 patient suspect monitoring. Remember when I said earlier that we make people triage themselves in موعد. So if I triage myself and I have my triage says we give a score, if the score is high enough, it will automatically be mobilized to تقصي, and in تقصي somebody will call that patient to bring him over for testing and medical check. So that is the service part. The second part is we used تقصي for all patients in the quarantine. We used تقصي to put the data, follow-up data for all patients in the hospital. We also use تقصي to do the daily data collection from patients under the isolation. And we also register mortalities inside تقصي. So تقصي is a hub for us today. It's an online platform. We just created this platform during this pandemic, and looking forward to have تقصي works for all communicable disease, not only for COVID-19. Next, please. This is the second thing which we developed during this pandemic, which is تطمن, which is in English, it's rest assured. Tatamman is a platform. We first thought of it to do the geofencing for those under isolation. But now we are on removing that criteria because Sadaya with Tawakkalna, they have their app, which will be, I will be highlighting it for it here as well. But then, because it's rest assured, we want to make sure that people use it as my caring partner on my phone. So it's a digital caring system where people can access easily through to 937, and 937 actually will call if you upload some symptoms, they will call you directly. All the education material are very accessible and it is tailored for you. As I said earlier in the beginning, we try to make all the awareness and education tailored because it reads your data, your health data, and your occupation and so forth. So it gives you public health information that is tailored for you. We also do daily monitoring of health status. We do have the symptoms. You put your own symptoms and it tells you how healthy you are. So it is another caring technique. And it also gives you a dashboard, gives you the dashboard of the disease itself. So it also tells you what's in the news out there. And up to date, we have 1.376 people, 1,376,000 registered in Tatamman. We have more than 900,000 people booked appointment through it, appointment for mass testing. We have also 300,000 help requests, which we reacted for. We have also followed up more than 500 people under isolation, in home isolation, prior to Tawakkalna took that function from us. Or took that function, we want them to take that function actually, because we want this to be caring body. Next, please. The mass testing journey. Actually, from the beginning of the disease, we said, we thought that people will be running out to test themselves. Why don't we create something new? We saw it actually in Korea, in South Korea, and we said it's perfect, fantastic idea. We immediately run places for drive-through and mass testing, and we have a location in 17 cities. We tested more than nearly 1.5 million people in these mass testing drive-through. We have 3 locations in Riyadh, 2 locations in Jeddah, 1 in Mecca, 1 in Medina, 1 in Asir, 1 in Dammam, plenty in 17 cities. And the smaller city, we have many drive-through. The big one has 12 drive-through. The smaller one have 6 or 4 drive-through, depends on the size of the city and the size of the population. As I said earlier, appointments booking is very easy through Sahati application. If you remember that, the application which I said, the platform for the people, and through the Tatamman application as well, we can book. Lately, we created ability to book also through the primary healthcare. So sometimes people go for primary healthcare, they have some symptoms and they don't recognize that could be for symptoms of COVID, but the doctor has the privilege to book them testing in these centers. This strategy helped us to increase our testing and isolation tremendously. If you remember, I said earlier that our goal is to test 80% at least of those symptomatic. With the mass testing, and we have the fever clinic. I'm not talking about it here because it's different venue. The fever clinic, which we created in Saudi Arabia, which is called Tatamman Clinic, we delivered access to care to 100% of people who wants to test. Our assumption that 80 to 90% of people with symptoms, they go for testing and they get it. 100% of those who go, they get the testing, and 90% of people with symptoms, they reach out to these centers, either the testing or Tatamman clinic. Next, please. At the beginning, I said that we have a collaboration, and thankfully, we have Sadaya in Saudi Arabia. They help us tremendously to develop our tracking or tracing apps. And the geofencing, we have it in Tatamman, but we don't want to have it because we don't want people to look at it as a tool that we might restrict their movement. We want them to register because it's a caring tool. So Tawakkalna took that role. It's a fantastic app. People can get permission during the curfew time. People, they used to get permission to walk, permission to go do some essential house groceries purchasing, or if they want to go to healthcare services. So these choices were there, and it served people fantastically. The one on the left is Taba'ud. Taba'ud is an app where it sends a notification for those who have been in your contact zone if you are a case. For example, if I'm a case today and I'm registering, once Taqassi capture me, it sends my information to Tawakkalna. So Tawakkalna will restrict me, and the Taba'ud part is optional. It's my option. Do I share with people who have been in contact with me? Of course, all the data is anonymous. Nobody knows who is that person who shared his data with you. But it is optional again. I share my result, so people who were in contact with me during certain period of time, at certain distance, at certain social barrier, they will be notified that you have somebody who has been in contact with you who is positive now. So they give them the option again to test and trace. Next. That's it for my data, but there is something here that we in Saudi Arabia very proudly serve the pilgrims who come to Hajj every year in huge numbers. Over the last 10 years, our number were never dropped below 1.8 million pilgrimage in Hajj. Last year we had 2.5 million people. The crowded picture show one prayer time during Hajj last year. And we in Saudi Arabia built our capacity digitally to develop an early warning system where we have a syndromic information, and all healthcare provider sites in Mecca and Medina capture this syndromic bundle. And once the patient has these symptoms or syndromic criteria, it push up the data to the EOC in Mecca. We see it and we react to it. So in the last 5 years, we haven't had any public health since we developed the EWAS actually in 2016, and ever since it's the surveillance program, and we have never had any public health threatening outbreaks in Hajj. This year we experienced that actually in 2014. Hajj was during the MERS, Hajj was safe, alhamdulillah, and everything went smoothly. 2009, again, we in Saudi Arabia were capable to handle it. 2009 with the H1N1, we were capable to handle it, and nothing went wrong, and it went smoothly. But this year, because of the flight restriction and the worldwide pandemic alertness was really, really unprecedented. And that is the picture on the right, where we have how did we implement social distancing in pilgrims. We continuously having our early warning system functioning during Hajj this season as well. We used our application for تطمن, for تقصي, for all of these pilgrims who have performed Hajj. And I think this is a great lesson to us in the future. How can we control a better and easier Hajj season? And how can we use digitization again in controlling pilgrims' movement and time permission inside the holy city of Mecca? Last slide. Sorry, it took so long. If we look at the way forward that we want to have, I'll just simplify it, make it one sentence. We want to have a public health technology that is equivalent to individualized service technology that we see in hospitals and primary healthcare. In public health, I don't know, it's a big challenge. We need to have it. The world need to have it. I'm 100% sure many countries, they created their own, just like what we did. Many countries have their marketing, or many organizations actually marketing a new product, but we want to have the good one, which looks like the one we have in hospitals and primary care. Thank you very much for listening. I'm sorry I took a little bit long. Thank you.